Question 1. Quality control measures reveal inconsistencies in the application of outcome measures for patients with stroke, impacting the objective assessment of functional recovery. As a neurologic certified specialist, what is the most appropriate strategy to optimize the use of outcome measures in clinical practice? Option A. Rely primarily on the patient's subjective verbal reports of improvement to gauge functional recovery, as this reflects their personal experience of the condition. Option B. Implement a broad range of commonly used outcome measures for various neurologic conditions to ensure comprehensive data collection, regardless of specific patient diagnosis. Option C. Prioritize the use of outcome measures that are quickest to administer and document, even if their psychometric properties or clinical relevance are less established. Option D. Systematically select and integrate validated, condition-specific outcome measures into the initial assessment and ongoing monitoring protocols to track patient progress and inform treatment adjustments. Correct answer is D. Systematically select and integrate validated, condition-specific outcome measures into the initial assessment and ongoing monitoring protocols to track patient progress and inform treatment adjustments. Explanation. This scenario presents a professional challenge because it requires the Neurologic Certified Specialist, NCS, to balance the efficient use of clinical resources with the imperative to provide evidence-based, patient-centered care. The challenge lies in determining how to best integrate outcome measures into routine practice without compromising the quality of patient assessment or overburdening the clinical workflow. Careful judgment is required to select and implement outcome measures that are both clinically relevant and practically feasible. The correct approach involves a systematic and evidence-based selection of validated outcome measures that align with the specific neurologic conditions being treated and the goals of care. This approach prioritizes the use of measures that have demonstrated reliability and validity in the neurologic population, ensuring that the data collected is meaningful and actionable. By integrating these measures into the initial assessment and ongoing monitoring, the NCS can objectively track patient progress, identify areas for intervention, and demonstrate the effectiveness of their treatment plan. This aligns with professional ethical obligations to provide competent and evidence-based care and regulatory expectations for quality improvement and data-driven decision-making in healthcare. An incorrect approach would be to rely solely on subjective patient reports without objective measurement. This fails to provide a quantifiable baseline or track progress objectively, potentially leading to misinterpretations of patient status and suboptimal treatment adjustments. It also neglects the regulatory emphasis on objective data for quality assessment and reporting. Another incorrect approach would be to implement a wide array of outcome measures without considering their relevance to the specific patient population or the clinical setting. This can lead to data overload, reduced efficiency, and a lack of focus on the most critical aspects of patient recovery, potentially violating principles of efficient resource utilization and patient-centered care. Finally, an approach that prioritizes administrative convenience over clinical utility, selecting measures that are easy to document but lack robust psychometric properties or clinical relevance, would be ethically and professionally unsound, as it compromises the integrity of the assessment process and patient care. Professional reasoning in such situations requires a commitment to lifelong learning, staying abreast of current evidence regarding outcome measures in neurology, and critically evaluating the applicability of different tools. NCSs should engage in a process of selecting measures that are sensitive to change, responsive to intervention, and interpretable within the context of the patient's condition and functional goals. Collaboration with colleagues and consideration of institutional guidelines can further refine this process, ensuring a standardized yet individualized approach to outcome measurement. Question 2. Regulatory review indicates that a patient diagnosed with a homonymous hemianopsia following a recent stroke presents a potential risk to public safety if they continue to operate a motor vehicle. What is the neurologist's primary professional and ethical obligation in this situation, considering the need to protect both the patient and the public? Option A. Immediately report the patient's visual field deficit to the Department of Motor Vehicles without prior discussion with the patient to ensure prompt action. Option B. Advise the patient directly and empathetically about the visual field deficit, its implications for driving safety, and the legal requirement to report this condition to the relevant licensing authority, strongly recommending they refrain from driving until medically cleared. Option C. Document the visual field deficit in the patient's chart, but provide no specific advice regarding driving, assuming the patient will self-regulate. Option D. Focus solely on the medical management of the stroke and inform the patient that driving is their personal responsibility. The correct answer is B. Advise the patient directly and empathetically about the visual field deficit, its implications for driving safety, and the legal requirement to report this condition to the relevant licensing authority, strongly recommending they refrain from driving until medically cleared. Explanation. This scenario presents a professional challenge because it requires a neurologist to balance the immediate needs of a patient experiencing a new visual field deficit with the complex ethical and regulatory considerations surrounding the reporting of such findings. The neurologist must act swiftly to diagnose and manage the patient's condition, while also adhering to legal and professional obligations regarding patient safety and public welfare, particularly if the deficit impacts the patient's ability to drive. The challenge lies in determining the appropriate scope of intervention and communication without overstepping professional boundaries or violating patient confidentiality. The correct approach involves a thorough neurological examination to confirm the visual field cut, determine its likely cause, e.g., stroke, tumor, and assess its impact on the patient's functional abilities, especially regarding driving. This is followed by a direct, empathetic discussion with the patient about the findings, their implications, and potential management strategies. Crucially, this approach includes advising the patient on the legal requirements and risks associated with driving with such a deficit and strongly recommending they refrain from driving until cleared by a medical professional and relevant authorities. This aligns with the neurologist's duty of care to the patient and the broader ethical obligation to prevent harm to the public. Regulatory frameworks, such as those governing medical practice and driver licensing, mandate reporting or advising patients to report such conditions to relevant authorities to ensure public safety. An incorrect approach would be to solely focus on the medical diagnosis and treatment without addressing the driving implications. This fails to uphold the neurologist's responsibility to consider the patient's safety and the safety of others. Legally and ethically, a significant visual field deficit can render a patient unsafe to operate a motor vehicle, and a failure to advise on this or facilitate appropriate reporting could have serious consequences. Another incorrect approach would be to unilaterally report the patient's condition to the Department of Motor Vehicles, DMV, without first discussing it with the patient and attempting to gain their cooperation. This would violate patient confidentiality and could erode the trust essential for the therapeutic relationship. While reporting may ultimately be necessary, it should be a collaborative process or a last resort after the patient has been informed and given an opportunity to act responsibly. A third incorrect approach would be to dismiss the visual field deficit as minor and not requiring any specific action beyond general advice. This underestimates the potential impact of such deficits on driving ability and public safety, potentially leading to a dangerous situation. Professional judgment requires a careful assessment of the severity and functional impact of the deficit, not a casual dismissal. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Confirm the diagnosis and assess the functional impact of the neurological deficit. 2. Understand the relevant legal and regulatory requirements for reporting or advising patients regarding conditions that affect driving. 3. Engage in open and honest communication with the patient about the findings, risks, and responsibilities. 4. Collaborate with the patient on a plan of action, including advising them to cease driving and to report to the appropriate authorities if necessary. 5. Document all assessments, discussions, and recommendations thoroughly. Question 3. Risk assessment procedures indicate a patient presence with a complex pattern of visual field deficits, including difficulties with object recognition and motion perception, alongside a partial homonymous hemianopia. Given the suspected involvement of both the primary visual cortex and extrastriate visual areas, what is the most appropriate initial diagnostic and management strategy for a neurologic certified specialist to implement, adhering strictly to the regulatory framework for neurological practice within the United States? Option A. Prescribe empirical treatment for a common neurological condition like migraine with aura, as visual disturbances are a frequent symptom, and schedule a follow-up appointment in 1 month. Option B. Focus solely on managing the homonymous hemianopia by recommending compensatory strategies for the patient and deferring further neuroimaging until the patient's symptoms stabilize. Option C. Order a high-resolution MRI of the brain with specific sequences tailored to visualize the occipital lobes and visual pathways, and initiate a consultation with an ophthalmologist for a comprehensive ocular examination to rule out primary retinal or optic nerve pathology. Option D. Refer the patient to a neurosurgeon for immediate surgical intervention based on the initial suspicion of a lesion, without further detailed neurological or ophthalmological evaluation. Correct answer is C. Order a high-resolution MRI of the brain with specific sequences tailored to visualize the occipital lobes and visual pathways, and initiate a consultation with an ophthalmologist for a comprehensive ocular examination to rule out primary retinal or optic nerve pathology. Explanation. Scenario analysis. This scenario presents a professional challenge in a clinical setting where a neurological specialist must interpret complex visual field deficits in a patient with a suspected lesion affecting the primary and secondary visual cortices. The challenge lies in accurately localizing the lesion and understanding its functional implications based on the observed visual field defects, while adhering to strict professional standards and patient care protocols. The specialist must integrate knowledge of neuroanatomy, visual pathways, and clinical presentation to arrive at a correct diagnosis and treatment plan, ensuring patient safety and optimal outcomes. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's visual field deficits, correlating them with known anatomical pathways of the primary, V1, and secondary, V2-V5, visual cortices. This includes recognizing that specific patterns of visual field loss, such as homonymous hemianopia with macular sparing, suggestive of occipital lobe involvement, potentially V1, or more complex deficits like visual agnosias or altered motion perception, suggestive of extrastriate cortex involvement, V2-V5, are indicative of lesions in these areas. The specialist must then consider the most likely etiologies for such lesions within the specified jurisdiction's healthcare framework, which might include stroke, tumor, or inflammatory processes, and initiate appropriate diagnostic workup and management, as per established clinical guidelines and regulatory requirements for neurological care. This approach prioritizes accurate diagnosis and evidence-based treatment, aligning with the professional duty of care and the standards expected of a neurologic certified specialist. Incorrect approaches analysis. One incorrect approach would be to solely focus on the gross anatomical location of a suspected lesion without meticulously analyzing the specific patterns of visual field deficits. This fails to acknowledge the functional specialization within the visual cortex and the precise mapping of visual information. Regulatory failure occurs because it bypasses the detailed diagnostic process required for accurate neurological assessment, potentially leading to misdiagnosis and inappropriate treatment, thus violating the standard of care. Another incorrect approach would be to attribute all visual disturbances to a single, generalized cause without considering the differential diagnoses that could affect the primary and secondary visual cortices. This lacks the depth of analysis required for complex neurological presentations and ignores the possibility of multiple contributing factors or less common etiologies. Ethically, this approach is flawed as it does not demonstrate due diligence in exploring all plausible diagnostic avenues, potentially compromising patient care by overlooking critical diagnostic information. A third incorrect approach would be to rely on outdated or unverified diagnostic techniques or treatment modalities. In the context of a neurologic certified specialist, adherence to current best practices and evidence-based medicine is paramount. Using methods not supported by current research or regulatory approval would constitute a significant professional and ethical breach, potentially harming the patient and undermining the credibility of the specialist and the profession. Professional reasoning. Professionals facing such a scenario should employ a structured clinical reasoning process. This begins with a thorough patient history and neurological examination, with a specific focus on detailed visual assessment. The specialist must then integrate this clinical data with their advanced knowledge of neuroanatomy and neurophysiology, specifically concerning the visual pathways and cortical processing. This integration allows for the generation of differential diagnoses, which are then systematically investigated through appropriate neuroimaging and other diagnostic tests. Treatment planning should be evidence-based, patient-centered, and compliant with all relevant jurisdictional regulations and ethical guidelines. Continuous professional development and staying abreast of the latest research and clinical guidelines are crucial for maintaining competence in managing complex neurological conditions. Question 4. The assessment process reveals a patient presenting with heightened fear responses and difficulty regulating emotional intensity, with preliminary findings suggesting atypical amygdala activation patterns during emotional stimuli processing. Which of the following approaches best aligns with the established regulatory framework and ethical guidelines for a neurologic certified specialist, NCS, in managing such a case? Option A. Initiate a targeted neuromodulation therapy aimed at recalibrating amygdala activity based on the observed activation patterns, without further extensive patient consultation beyond initial consent for assessment. Option B. Refer the patient to a psychiatrist for management of emotional symptoms, without further direct involvement in assessing the neurologic underpinnings of the amygdala's contribution to the patient's presentation. Option C. Conduct a comprehensive neurologic evaluation, including detailed history, physical examination, and consideration of neuroimaging or electrophysiologic studies if indicated, to fully understand the patient's emotional dysregulation in the context of their overall neurologic health, and develop a collaborative, evidence-based treatment plan with the patient. Option D. Prescribe anxiolytic medication to immediately suppress the heightened fear responses, deferring further investigation into the amygdala's specific role until the patient's acute distress has subsided. Correct answer is A. Initiate a targeted neuromodulation therapy aimed at recalibrating amygdala activity based on the observed activation patterns, without further extensive patient consultation beyond initial consent for assessment. Explanation. The assessment process reveals a patient exhibiting significant emotional dysregulation, impacting their ability to engage in therapeutic interventions. This scenario is professionally challenging because it requires the specialist to not only understand the neurobiological underpinnings of emotional processing, specifically involving the amygdala, but also to apply this knowledge within the strict ethical and regulatory framework governing neurologic practice. The challenge lies in balancing the need for effective patient care with the imperative to adhere to professional standards, patient autonomy, and data privacy. The correct approach involves a comprehensive assessment of the amygdala's role in the patient's emotional state, integrating findings with other neurologic assessments, and developing a treatment plan that is evidence-based and patient-centered. This approach is ethically justified by the principle of beneficence, ensuring the patient receives the most appropriate and effective care, and by the principle of non-maleficence, avoiding interventions that could exacerbate their condition. Regulatory compliance is maintained by documenting all assessments and interventions thoroughly, obtaining informed consent for all procedures, and respecting patient confidentiality, aligning with established neurologic practice guidelines and relevant professional codes of conduct. An incorrect approach would be to solely focus on the amygdala's function without considering the broader clinical picture or the patient's overall well-being. This fails to uphold the principle of holistic patient care and may lead to an incomplete or misdirected treatment plan. Another incorrect approach would be to implement interventions based on anecdotal evidence or personal opinion rather than established neurologic protocols, violating the standard of care and potentially causing harm. Furthermore, failing to obtain informed consent for any diagnostic or therapeutic procedures related to the amygdala's function would be a significant ethical and regulatory breach, undermining patient autonomy and trust. Professional decision-making in such situations requires a systematic process. First, thoroughly understanding the patient's presentation and its potential neurobiological correlates. Second, consulting relevant, up-to-date neurologic literature and guidelines. Third, collaborating with other healthcare professionals as needed. Fourth, engaging the patient in shared decision-making, ensuring their values and preferences are considered. And finally, meticulously documenting all steps taken and the rationale behind them, ensuring accountability and adherence to regulatory requirements. Question 5. Operational review demonstrates a patient presenting with fluctuating blood pressure, irregular heart rate, and periods of shallow, irregular breathing. The Neurologic Certified Specialist, NCS, is tasked with evaluating the potential neurological underpinnings of these vital sign abnormalities. Which of the following approaches best aligns with the NCS's role in assessing and managing such a patient? Option A. Initiate immediate pharmacological interventions to stabilize blood pressure and respiratory rate based on current vital signs, deferring detailed neurological assessment until the patient is hemodynamically stable. Option B. Conduct a comprehensive neurological examination, including assessment of cranial nerves, motor function, sensory pathways, and reflexes, while simultaneously monitoring vital signs and considering the potential involvement of the brainstem and diencephalon in regulating cardiovascular and respiratory functions. Option C. Focus solely on the respiratory symptoms, initiating mechanical ventilation if oxygen saturation drops below a predefined threshold, without a thorough investigation into the central nervous system's role in the patient's overall condition. Option D. Rely on the patient's reported subjective feelings of distress to guide the management of vital signs, prioritizing comfort over objective physiological assessment of neurological control centers. The correct answer is A. Initiate immediate pharmacological interventions to stabilize blood pressure and respiratory rate based on current vital signs, deferring detailed neurological assessment until the patient is hemodynamically stable. Explanation. This scenario presents a professional challenge because it requires the Neurologic Certified Specialist, NCS, to interpret complex physiological data in the context of patient care, specifically concerning the regulation of vital cardiovascular and respiratory functions. The challenge lies in accurately identifying the source of dysfunction and implementing appropriate interventions, which directly impacts patient safety and outcomes. The NCS must possess a deep understanding of the interplay between the central nervous system's control centers and the autonomic nervous system's regulation of these critical systems. The correct approach involves a systematic evaluation of the patient's presentation, correlating the observed signs and symptoms with known patterns of dysfunction in the brainstem and diencephalon, which house the primary cardiovascular and respiratory control centers. This approach prioritizes a comprehensive assessment of neurological status, vital signs, and potentially advanced neuroimaging or physiological monitoring to pinpoint the affected area. Justification for this approach is rooted in the NCS's ethical obligation to provide competent and evidence-based care, adhering to established clinical guidelines and best practices for managing neurological emergencies. Accurate diagnosis is paramount to initiating timely and effective treatment, thereby minimizing morbidity and mortality. An incorrect approach would be to solely focus on symptomatic treatment without a thorough neurological assessment. For instance, administering medications to manage blood pressure or respiratory rate without understanding the underlying neurological cause could mask critical signs, delay definitive diagnosis, and potentially exacerbate the patient's condition. This failure violates the principle of beneficence and non-maleficence, as it risks harm by not addressing the root cause. Another incorrect approach would be to rely solely on peripheral indicators without considering the central regulatory mechanisms. This overlooks the fundamental role of the brainstem and diencephalon in maintaining homeostasis and could lead to misdiagnosis and inappropriate management strategies, failing to meet the standard of care expected of a certified specialist. Professionals should employ a structured decision-making process that begins with a thorough patient history and physical examination, followed by a targeted neurological assessment. This should then guide the selection of appropriate diagnostic tools, considering the potential involvement of cardiovascular and respiratory control centers. Collaboration with other healthcare professionals, such as physicians and respiratory therapists, is crucial for a multidisciplinary approach. Continuous monitoring and reassessment are essential to track the patient's response to interventions and adjust the treatment plan accordingly. Question 6. Research into a patient presenting with significant apathy, anhedonia, and marked emotional blunting, alongside reports of difficulty initiating tasks and maintaining motivation, suggests potential dysfunction within the limbic system, particularly the cingulate gyrus. Given these symptoms, which of the following diagnostic approaches best aligns with the role and responsibilities of a neurologic certified specialist, NCS, in evaluating this patient? Option A. Administer a battery of neuropsychological tests designed to assess executive functions and mood disorders, and based on the results, provide a preliminary diagnosis of a mood disorder. Option B. Conduct a comprehensive neurophysiologic assessment utilizing quantitative electroencephalography, QEEG, and evoked potentials to evaluate the functional integrity of the anterior cingulate cortex and its connectivity with other limbic structures, correlating findings with the patient's reported deficits in emotion and motivation. Option C. Prescribe a course of psychotropic medication aimed at improving mood and motivation, and monitor the patient's response to treatment through subjective feedback. Option D. Rely solely on a detailed psychiatric interview and behavioral observation to document the patient's emotional state and motivational capacity, and then refer the patient for a psychiatric consultation. The correct answer is B. Conduct a comprehensive neurophysiologic assessment utilizing quantitative electroencephalography, QEEG, and evoked potentials to evaluate the functional integrity of the anterior cingulate cortex and its connectivity with other limbic structures, correlating findings with the patient's reported deficits in emotion and motivation. Explanation: this scenario presents a professional challenge because it requires a neurologic certified specialist, NCS, to interpret complex patient presentation involving emotional and motivational deficits, directly linking them to potential neuroanatomical dysfunction. The NCS must apply their specialized knowledge within the strict confines of the Neurologic Certified Specialist, NCS, regulatory framework, ensuring that their assessment and recommendations are evidence-based and ethically sound, without overstepping the scope of practice or making definitive diagnoses that are the purview of physicians. The challenge lies in translating observed behaviors and reported subjective experiences into a neurophysiologically informed understanding, while adhering to professional standards of care and documentation. The correct approach involves a comprehensive neurophysiologic assessment that specifically targets the functional integrity of the cingulate gyrus and its associated circuits. This includes utilizing electrophysiologic techniques that can evaluate neural activity and connectivity within these regions, such as evoked potentials or quantitative EEG, to identify objective markers of dysfunction. The NCS would then correlate these findings with the patient's reported emotional lability, anhedonia, and motivational impairments. This approach is correct because it directly addresses the core of the patient's presentation by investigating the suspected neuroanatomical substrate using appropriate, evidence-based diagnostic tools within the NCS scope of practice. It aligns with the NCS certification's emphasis on applying advanced neurologic knowledge to patient care and contributing to diagnostic processes under physician supervision. An incorrect approach would be to solely rely on subjective patient reports and behavioral observations without objective neurophysiologic data. This fails to meet the NCS standard of practice, which mandates the use of specialized electrophysiologic techniques to investigate neurologic function. It also risks misinterpreting symptoms or attributing them to psychological factors without exploring underlying neurologic etiologies, which is a failure to adhere to the principle of thorough neurologic assessment. Another incorrect approach would be to make a definitive diagnosis of a specific psychiatric disorder based on the observed emotional and motivational symptoms. This oversteps the NCS scope of practice, as diagnosis is the responsibility of a physician. The NCS's role is to provide objective neurophysiologic data to aid the physician in diagnosis, not to make the diagnosis themselves. This constitutes a violation of professional boundaries and regulatory guidelines. A further incorrect approach would be to recommend a treatment plan without first establishing a clear neurophysiologic basis for the patient's symptoms. While NCSs contribute to patient management, their primary role in this context is diagnostic support. Recommending interventions without objective data from specialized assessments would be premature and potentially inappropriate, deviating from the evidence-based practice expected of a certified specialist. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the patient's presenting symptoms, focusing on both subjective reports and observable behaviors. Second, consider the potential neuroanatomical correlates of these symptoms, drawing upon specialized knowledge of brain function, such as the role of the cingulate gyrus in emotion and motivation. Third, identify appropriate neurophysiologic assessment tools within the NCS scope of practice that can objectively evaluate the suspected neural pathways. Fourth, Meticulously collect and analyze the data, ensuring accuracy and adherence to established protocols. Finally, interpret the findings in the context of the patient's clinical presentation and communicate these objective findings to the supervising physician to facilitate accurate diagnosis and appropriate management. Question 7. To address the challenge of accurately assessing a patient presenting with subtle changes in executive function, personality, and social behavior, which of the following evaluation strategies best reflects current best practices for a neurologic certified specialist? Option A. Initiating empirical treatment for common psychiatric conditions based on initial subjective reports of personality changes. Option B. Relying primarily on a standard neurological examination and patient self-reports to identify the cause of behavioral changes. Option C. Conducting a comprehensive evaluation that integrates a detailed neurological examination with a specific focus on executive functions, behavioral observations, neuropsychological testing, and appropriate neuroimaging. Option D. Focusing solely on neuroimaging to identify any structural abnormalities without detailed cognitive or behavioral assessments. The correct answer is C. Conducting a comprehensive evaluation that integrates a detailed neurological examination with a specific focus on executive functions, behavioral observations, neuropsychological testing, and appropriate neuroimaging. Explanation. Scenario analysis. This scenario presents a professional challenge due to the subtle and varied manifestations of frontal lobe dysfunction. A patient exhibiting changes in executive function, personality, and social behavior may not present with overt motor or sensory deficits, making accurate assessment and diagnosis complex. The challenge lies in differentiating frontal lobe symptoms from other neurological or psychiatric conditions, and in ensuring the patient receives appropriate, evidence-based intervention that align with best practices in neurologic care. The need for a comprehensive, multifaceted evaluation is paramount to avoid misdiagnosis and ensure optimal patient outcomes. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation that integrates multiple assessment modalities. This includes a detailed neurological examination focusing on executive functions, e.g., planning, problem-solving, abstract reasoning, behavioral observations, and a thorough patient and collateral history. Neuropsychological testing is crucial for objectively quantifying deficits in executive function, attention, and memory, which are hallmarks of frontal lobe pathology. Neuroimaging, such as MRI, is essential to identify structural abnormalities. This multimodal approach aligns with established best practices for diagnosing and managing complex neurological conditions, ensuring that all relevant aspects of the patient's presentation are considered and that interventions are tailored to their specific needs. This adheres to the principles of patient-centered care and evidence-based practice expected of a neurologic certified specialist. Incorrect approaches analysis. Relying solely on a standard neurological examination without specific assessment of executive functions would be an insufficient approach. This failure to probe key areas of frontal lobe function could lead to overlooking significant deficits, resulting in delayed or incorrect diagnosis. Similarly, focusing only on subjective reports of behavioral changes without objective neuropsychological assessment or neuroimaging lacks the rigor required for a definitive diagnosis and could lead to misattribution of symptoms to non-neurologic causes. Initiating treatment based on assumptions about the cause of behavioral changes without a thorough diagnostic workup is a significant ethical and professional failure, potentially leading to inappropriate therapies and harm to the patient. Professional reasoning. Professionals facing such challenges should adopt a systematic diagnostic framework. This begins with a broad differential diagnosis, considering all plausible etiologies. The next step is to gather comprehensive data through history, physical examination, and targeted investigations. Neuropsychological assessment plays a vital role in characterizing cognitive deficits, while neuroimaging helps identify structural correlates. Treatment planning should be based on a confirmed diagnosis and evidence-based guidelines, with ongoing monitoring to assess efficacy and adjust interventions as needed. Collaboration with other specialists, such as neuropsychologists and psychiatrists, is often essential for optimal patient management. Question 8. Analysis of a patient presenting with complaints of difficulty initiating voluntary eye movements and occasional visual scanning abnormalities. What is the most appropriate initial diagnostic approach to assess potential frontal eye fields, FEF, dysfunction? Option A. Rely solely on the patient's subjective description of visual disturbances to guide further investigation. Option B. Immediately refer the patient for a comprehensive ophthalmological examination to rule out primary visual pathway disorders. Option C. Order an urgent magnetic resonance imaging, MRI of the brain with a specific focus on the frontal lobes. Option D. Conduct a detailed bedside neurological examination focusing on voluntary saccadic eye movements, smooth pursuit and fixation, alongside a general neurological assessment. The correct answer is D. Conduct a detailed bedside neurological examination focusing on voluntary saccadic eye movements, smooth pursuit and fixation, alongside a general neurological assessment. Explanation: this scenario is professionally challenging because it requires the Neurologic Certified Specialist, NCS, to integrate complex neuroanatomical knowledge with patient care decisions, specifically concerning the assessment of frontal eye field, FEF, function in a patient presenting with potential neurological deficits. The challenge lies in accurately interpreting subtle clinical signs and selecting the most appropriate diagnostic pathway, ensuring patient safety and adherence to established clinical guidelines. Careful judgment is required to differentiate between true FEF dysfunction and other potential causes of visual or motor disturbances, avoiding unnecessary or potentially harmful interventions. The correct approach involves a systematic clinical examination that specifically assesses voluntary saccadic eye movements, smooth pursuit and fixation, while also considering the patient's overall neurological status and history. This approach is justified by the fundamental understanding of FEF's role in oculomotor control and executive functions. By directly evaluating these functions, the NCS can gather objective data to support or refute the hypothesis of FEF involvement. Adherence to established neurological assessment protocols and diagnostic algorithms, as typically outlined in professional practice guidelines for neurological assessment, ensures that the evaluation is comprehensive and evidence-based. An incorrect approach would be to solely rely on a patient's subjective report of visual disturbances without a targeted oculomotor examination. This fails to objectively assess FEF function and could lead to misdiagnosis or delayed diagnosis of underlying neurological pathology, neglects the principle of thorough clinical investigation. Another incorrect approach would be to immediately order advanced neuroimaging without a preceding detailed clinical assessment. While imaging is crucial, it should be guided by clinical findings to ensure appropriate use of resources and to avoid incidental findings that may not be relevant to the presenting symptoms. This approach bypasses the essential step of clinical correlation and can lead to unnecessary patient anxiety and healthcare costs. A further incorrect approach would be to attribute all visual complaints to a non-neurological cause without a comprehensive neurological workup, particularly when symptoms could be indicative of FEF dysfunction. This demonstrates a failure to consider differential diagnoses and adhere to the standard of care for neurological symptom evaluation. Professionals should employ a decision-making framework that begins with a detailed history and a targeted physical examination, focusing on the suspected neurological system. This is followed by the formulation of differential diagnoses, guiding the selection of appropriate diagnostic tests, which may include specialized neurological assessments or imaging. Throughout this process, continuous reevaluation of findings and correlation with clinical presentation are paramount to ensure accurate diagnosis and effective patient management, always within the scope of practice and ethical guidelines. Question 9. The investigation demonstrates a patient presenting with a distinct pattern of sensory loss, including diminished pain and temperature sensation on the contralateral side of the body, with preserved fine touch and proprioception. Imaging reveals a lesion in the right lateral spinothalamic tract. Which of the following diagnostic interpretations and subsequent management considerations best aligns with the established regulatory framework for a neurologic certified specialist? Option A. Focus solely on the MRI findings and disregard the patient's subjective reports of sensory loss, proceeding with a treatment plan based only on the anatomical lesion. Option B. Conclude that the lesion in the right lateral spinothalamic tract is the sole cause of the contralateral sensory deficits and initiate a treatment plan focused on symptomatic pain management without further investigation. Option C. Attribute the sensory deficits to a generalized neurological issue and recommend a broad, non-specific diagnostic workup without prioritizing the specific findings related to the spinothalamic tract. Option D. Correlate the imaging findings of the right lateral spinothalamic tract lesion with the patient's reported deficits in pain and temperature sensation, considering potential etiologies for the lesion and recommending further investigations to confirm the extent of tract involvement and rule out other contributing factors. The correct answer is B. Conclude that the lesion in the right lateral spinothalamic tract is the sole cause of the contralateral sensory deficits and initiate a treatment plan focused on symptomatic pain management without further investigation. Explanation: this scenario presents a professional challenge because the Neurologic Certified Specialist, NCS, must interpret complex diagnostic findings related to the spinothalamic tracts, which are crucial for transmitting pain, temperature, and crude touch sensations. Misinterpreting these findings could lead to incorrect treatment plans, delayed interventions, and potentially compromise patient safety and outcomes. The NCS must apply their specialized knowledge within the strict regulatory framework governing their practice, ensuring all diagnostic and interpretive actions align with established standards of care and ethical guidelines. The correct approach involves a comprehensive review of all available diagnostic data, including imaging, electrophysiologic studies, and detailed neurological examination findings, specifically correlating them with the expected deficits associated with spinothalamic tract dysfunction. This systematic correlation allows for accurate localization of the lesion and a precise understanding of the sensory deficits. This approach is ethically and regulatorily sound, as it prioritizes patient well-being through accurate diagnosis, which is a fundamental ethical obligation. It aligns with professional standards that mandate evidence-based practice and thoroughness in patient assessment. An incorrect approach would be to solely rely on a single diagnostic modality without considering the full clinical picture. For instance, focusing only on MRI findings without correlating them with the patient's reported sensory deficits or objective findings from a neurological exam would be a failure to integrate all relevant information. This could lead to an incomplete or inaccurate diagnosis, violating the ethical duty to provide competent care. Another incorrect approach would be to prematurely conclude a diagnosis based on initial findings without considering differential diagnoses or alternative explanations for the observed symptoms. This haste could lead to misdiagnosis and inappropriate management, contravening regulatory requirements for due diligence and professional accountability. Furthermore, failing to document the rationale for diagnostic interpretations and treatment recommendations would be a significant regulatory and ethical lapse, hindering peer review and potentially exposing the NCS to liability. Professionals should employ a structured decision-making process that begins with a thorough understanding of the patient's history and presenting symptoms. This is followed by a systematic neurological examination, focusing on sensory modalities mediated by the spinothalamic tracts. All diagnostic tests should be ordered and interpreted in light of this clinical assessment. The NCS must then synthesize all findings, critically evaluating the evidence to arrive at the most probable diagnosis, considering differential diagnoses. This process must be meticulously documented, and any proposed interventions should be clearly justified based on the diagnostic findings and established clinical guidelines, always adhering to the specific regulatory framework governing NCS practice. Question 10. During the evaluation of a patient presenting with paradoxical breathing and irregular respiratory rate, which of the following diagnostic considerations best reflects the potential involvement of central respiratory control mechanisms? Option A. Correlating the breathing pattern with the location of a suspected brainstem lesion. Option B. Evaluating the patient's response to bronchodilator therapy. Option C. Assessing the integrity of the phrenic nerve and diaphragm function. Option D. Monitoring peripheral oxygen saturation levels. The correct answer is C. Assessing the integrity of the phrenic nerve and diaphragm function. Explanation: this scenario presents a professional challenge because the certified specialist must integrate complex neurophysiological data with clinical presentation to accurately diagnose and manage a patient with potential respiratory compromise originating from central nervous system dysfunction. The specialist's judgment is critical in differentiating between primary respiratory pathology and secondary effects of neurologic conditions, which has significant implications for treatment and patient outcomes. Adherence to the Neurologic Certified Specialist (NCS) regulatory framework, which emphasizes evidence-based practice and patient safety, is paramount. The correct approach involves a systematic assessment of the patient's respiratory status, correlating findings with the known neuroanatomy and neurophysiology of respiratory control centers. This includes evaluating the patient's breathing pattern, depth, and rate, and considering the potential impact of lesions in areas such as the brainstem, medulla and pons, or higher cortical centers that influence respiratory drive. The specialist must then interpret electrophysiologic data, such as evoked potentials or EEG, in the context of these clinical and anatomical considerations. This integrated approach aligns with the NCS scope of practice, which requires the application of advanced knowledge and skills in neurologic assessment and management, prioritizing patient well-being and adherence to established clinical guidelines for neurologic emergencies. An incorrect approach would be to solely focus on peripheral respiratory parameters without considering the underlying neurologic etiology. For instance, initiating aggressive ventilatory support based only on oxygen saturation levels without a thorough neurologic assessment could mask or exacerbate a central respiratory drive issue, potentially leading to inappropriate treatment and adverse patient outcomes. This fails to meet the NCS standard of care, which mandates a comprehensive, integrated approach to neurologic patient management. Another incorrect approach would be to attribute respiratory changes solely to a known neurologic condition, without investigating the specific respiratory control mechanisms affected. This oversight neglects the detailed understanding of respiratory centers required for accurate diagnosis and targeted intervention. Deviating from the specialized knowledge expected of an NCS, professionals should employ a decision-making framework that begins with a thorough clinical assessment, including a detailed respiratory evaluation and neurological examination. This is followed by the interpretation of relevant diagnostic data, such as neuroimaging and electrophysiologic studies, within the context of the patient's overall neurologic condition. The specialist must then synthesize this information to formulate a differential diagnosis, prioritizing potential central nervous system causes of respiratory dysfunction. Treatment strategies should be tailored to address the identified underlying neurologic issue and its impact on respiratory centers, in collaboration with the interdisciplinary team. This systematic, evidence-based approach ensures that patient care is both effective and ethically sound, adhering to the highest standards of neurologic specialization. Question 11. Benchmark analysis indicates that a patient presents with significant gait ataxia, marked truncal instability, and a notable impairment in performing rapid alternating movements of the upper extremities. Considering the distinct functional roles of the cerebellar lobes, which of the following best represents the most likely localization of the underlying pathology? Option A, primarily flocculonodular lobe. Option B, non-cerebellar etiology unrelated to motor control. Option C, generalized cerebellar dysfunction without specific lobe localization. Option D, primarily anterior and posterior cerebellar lobes. The correct answer is D, primarily anterior and posterior cerebellar lobes. Explanation: scenario analysis. This scenario is professionally challenging because it requires the Neurologic Certified Specialist (NCS) to integrate knowledge of cerebellar anatomy with clinical presentation to accurately diagnose a patient's functional deficits. Misinterpreting the role of specific cerebellar lobes can lead to incorrect diagnostic conclusion, delayed or inappropriate treatment, and potentially negative patient outcomes. The NCS must demonstrate a nuanced understanding of how damage to distinct cerebellar regions manifests, moving beyond generalized cerebellar dysfunction. Correct approach analysis. The correct approach involves correlating the patient's specific gait ataxia, truncal instability, and difficulty with rapid alternating movements, with the known functions of the anterior and posterior cerebellar lobes. Anterior lobe is primarily involved in regulating gait and posture, while the posterior lobe plays a crucial role in coordinating voluntary movements, including fine motor control and rapid alternating movements. Therefore, identifying deficits in these specific areas strongly implicates damage to these lobes. This aligns with best practices in neurologic assessment, which emphasize precise localization of lesions based on clinical signs and symptoms, adhering to the principle of accurate diagnosis as a foundation for effective patient care. Incorrect approach is analysis. An approach focusing solely on the flocculonodular lobe would be incorrect. While the flocculonodular lobe is critical for balance and eye movements, the described symptoms of gait ataxia and difficulty with rapid alternating movements are more characteristic of anterior and posterior lobe involvement. Overemphasizing the flocculonodular lobe would lead to an incomplete or inaccurate diagnosis. An approach that attributes all observed motor deficits to generalized cerebellar dysfunction, without attempting to localize them to specific lobes, is also incorrect. While the cerebellum functions as a whole, specific clinical presentations are often indicative of damage to particular regions. Failing to differentiate based on lobe-specific functions represents a failure to apply a high level of specialized knowledge expected of an NCS, potentially hindering targeted therapeutic interventions. An approach that dismisses the observed gait and coordination issues as unrelated to cerebellar function would be a significant diagnostic error. The presented symptoms are classic indicators of cerebellar pathology, and ignoring them would violate the core principles of neurologic assessment and patient care. Professional reasoning. Professionals should approach such cases by first performing a thorough clinical examination, meticulously documenting all observed signs and symptoms. Next, they should systematically correlate these findings with the known functional anatomy of the nervous system, specifically considering the roles of different cerebellar lobes. This involves asking, which specific cerebellar lobe's primary functions are most directly affected by these observed deficits. The NCS should then formulate a differential diagnosis based on this correlation, prioritizing the most likely etiologies. Finally, they should consider further diagnostic investigations that would help confirm or refute the suspected localization of cerebellar damage. Question 12. Stakeholder feedback indicates that patients presenting with subjective complaints of auditory deficits and memory loss require careful assessment to determine the underlying neurological cause. As a neurologic certified specialist, NCS, candidate preparing for the examination, which of the following approaches best demonstrates an understanding of lesion effects relevant to these symptoms within the context of the NCS examination scope? Option A. Correlating the reported auditory deficits and memory loss with specific neuroanatomical locations and their known functional impairments as outlined in the NCS examination's curriculum. Option B. Attributing the symptoms to age-related changes or psychological stress without a detailed neurological examination. Option C. Focusing solely on the audiology and neuropsychology reports without considering the potential for focal brain lesions. Option D. Recommending immediate pharmacological interventions for memory enhancement and auditory amplification, without identifying the specific neurological lesion. The correct answer is A. Correlating the reported auditory deficits and memory loss with specific neuroanatomical locations and their known functional impairments as outlined in the NCS examination's curriculum. Explanation. This scenario is professionally challenging because it requires a neurologic certified specialist, NCS, to interpret subjective patient reports of auditory deficits and memory loss, which can be subtle and difficult to quantify objectively, and then translate these into actionable clinical insights within the strict confines of the neurologic certified specialist, NCS, examination's regulatory framework. The NCS must demonstrate an understanding of how specific lesion locations in the nervous system correlate with these reported deficits, adhering strictly to the established knowledge base and examination guidelines. The correct approach involves correlating the reported auditory deficits and memory loss with known neuroanatomical pathways and lesion effects as defined by the Neurologic Certified Specialist, NCS, examination's curriculum. This requires the NCS to access and apply their specialized knowledge of how damage to specific brain regions, such as the temporal lobe, auditory processing, memory encoding, or hippocampus, memory consolidation, would manifest as the reported symptoms. The justification for this approach lies in the core competency of an NCS to accurately diagnose and understand neurological conditions based on clinical presentation and underlying pathophysiology, as assessed by the examination. This aligns with the examination's objective to evaluate the candidate's mastery of neurologic principles and their application to patient care scenarios. An incorrect approach would be to dismiss the patient's subjective reports without further investigation, or to attribute the symptoms to non-neurologic causes without a thorough differential diagnosis. This fails to uphold the ethical obligation to take patient complaints seriously and to conduct a comprehensive neurological assessment. Another incorrect approach would be to rely on generalized knowledge of hearing loss or memory impairment without considering the specific neuroanatomical correlates that are central to the NCS examination. This demonstrates a lack of specialized knowledge and an inability to apply it to the specific context of neurologic lesions. Furthermore, an incorrect approach would be to speculate on potential treatments or interventions without a confirmed diagnosis based on lesion localization, which is premature and outside the scope of assessing lesion effects. The professional decision-making process for similar situations involves a systematic approach. First, acknowledging and validating the patient's reported symptoms. Second, activating specialized knowledge regarding neuroanatomy and the effects of lesions on specific neurological functions, such as auditory processing and memory. Third, formulating differential diagnoses based on the reported symptoms and potential lesion locations. Fourth, identifying the most likely lesion location, that explain the constellation of symptoms, drawing directly from the established knowledge base tested by the NCS examination. Finally, considering how this understanding informs further diagnostic steps or management, always within the scope of the NCS role as defined by the examination's parameters. Question 13. Comparative studies suggest that damage to the prefrontal cortex can significantly alter personality, executive functions, and behavioral regulation. A patient with a known history of a traumatic brain injury resulting in prefrontal cortex damage is expressing a strong desire to return to living independently, despite exhibiting poor impulse control, difficulty with planning, and a tendency to engage in risky behaviors that have previously led to harm. The Neurologic Certified Specialist, NCS, is tasked with assessing the patient's readiness for independent living and recommending a course of action. Which of the following approaches best aligns with professional and ethical obligations? Option A. Advise the patient's family to take full responsibility for the patient's care and decision-making, absolving the NCS of further involvement in the patient's living situation. Option B. Facilitate the patient's return to independent living immediately, as their expressed desire is paramount, and the NCS's role is to support patient autonomy. Option C. Inform the patient that their cognitive deficits make independent living impossible and arrange for immediate placement in a long-term care facility without further assessment or discussion. Option D. Conduct a comprehensive assessment of the patient's capacity for independent living, considering their executive function deficits, and collaborate with the interdisciplinary team and family to develop a safe and supportive care plan, which may include supervised living arrangements if necessary. The correct answer is B. Facilitate the patient's return to independent living immediately, as their expressed desire is paramount, and the NCS's role is to support patient autonomy. Explanation. This scenario presents a significant ethical challenge for a neurologic certified specialist, NCS, due to the profound impact of prefrontal cortex dysfunction on an individual's personality, behavior, and decision-making capacity. The core conflict lies in balancing the patient's expressed wishes, which may be influenced by their altered executive functions, with the need to protect their well-being and ensure their safety, especially when their judgment is compromised. The NCS must navigate the complexities of capacity assessment, informed consent, and the duty of care within the established regulatory framework for healthcare professionals. The correct approach involves a comprehensive, multifaceted assessment of the patient's capacity to make decisions regarding their treatment and living situation. This includes evaluating their understanding of their condition, the risks and benefits of proposed interventions, and the consequences of their choices. The NCS should collaborate with the patient's family, other healthcare providers, such as neurologists, psychiatrists, and social workers, and potentially legal counsel to gather a holistic picture. If the assessment reveals a significant deficit in executive functions leading to impaired judgment and an inability to make safe decisions, the NCS must advocate for appropriate interventions, which may include seeking guardianship or conservatorship, or implementing a care plan that prioritizes safety while respecting the patient's autonomy as much as possible. This aligns with ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory requirements for patient safety and appropriate care planning. An incorrect approach would be to solely rely on the patient's stated desires without a thorough capacity assessment, especially given the known impact of prefrontal cortex lesions on impulse control and foresight. This would violate the NCS's duty of care and could lead to harm. Another incorrect approach would be to unilaterally override the patient's wishes without due process or a formal determination of incapacity, which could infringe upon their rights and lead to legal repercussions. Furthermore, failing to involve the interdisciplinary team and family in the decision-making process would be a failure to provide comprehensive care and could result in suboptimal outcomes. Professionals should approach such situations by first recognizing the potential for cognitive impairment to affect decision-making. A structured capacity assessment, utilizing validated tools and involving multiple perspectives, is crucial. If capacity is questionable, the next step is to explore less restrictive interventions that support the patient's decision-making. If these are insufficient and significant risk is present, then pursuing formal legal avenues for decision-making support, such as guardianship, becomes necessary, always with the patient's best interests as the paramount consideration. Question 14. Process analysis reveals a patient presenting with a suspected right parietal lobe lesion. The clinical team requires an accurate assessment of potential sensory deficits and neglect to guide rehabilitation planning. Which approach best reflects the evaluation of these lesion effects for an NCS professional? Option A. Focus the assessment solely on gross motor function and visual acuity, as these are typically the most apparent deficits following a parietal lobe lesion. Option B. Rely primarily on the patient's verbal report of sensory disturbances and observe for obvious motor impairments, assuming neglect is absent if not explicitly mentioned by the patient. Option C. Document the presence of a possible sensory deficit and potential neglect based on a brief screening, without employing specific testing or detailed functional impact assessment. Option D. Conduct a detailed neurologic examination focusing on sensory modalities, e.g., light touch, proprioception, pain, temperature, and perform standardized bedside tests for unilateral spatial neglect, documenting all findings with specific descriptors of deficit severity and functional impact. Correct answer is D. Conduct a detailed neurologic examination focusing on sensory modalities, e.g., light touch, proprioception, pain, temperature, and perform standardized bedside tests for unilateral spatial neglect, documenting all findings with specific descriptors of deficit severity and functional impact. Explanation. This scenario presents a professional challenge because accurately assessing and documenting the impact of a neurologic lesion, specifically sensory deficits and neglect, requires a nuanced understanding of patient presentation, objective testing, and the application of established clinical guidelines. The challenge lies in differentiating between true sensory loss and attentional deficits, and in ensuring the documentation accurately reflects the patient's functional limitations and guides appropriate interventions, all within the scope of practice for a neurologic certified specialist, NCS. Careful judgment is required to avoid over or underestimating the deficit, which can have significant implications for patient care, rehabilitation planning, and communication with the interdisciplinary team. The correct approach involves a systematic and comprehensive evaluation that integrates subjective patient reports with objective findings. This approach prioritizes a thorough neurologic examination to identify the specific sensory modalities affected and the spatial distribution of any neglect. It also emphasizes the use of standardized assessment tools and the clear, concise documentation of findings, including the impact on functional activities. This aligns with best practices in neurologic assessment, which mandate evidence-based evaluation and accurate record-keeping to ensure continuity of care and adherence to professional standards. Regulatory frameworks for NCS professionals typically require adherence to established diagnostic criteria and documentation standards to ensure patient safety and quality of care. An incorrect approach that relies solely on subjective patient reports without objective verification fails to meet the standards of a comprehensive neurologic assessment. This can lead to misdiagnosis and inappropriate treatment plans, potentially violating ethical obligations to provide competent care. Another incorrect approach that focuses only on gross motor deficits while overlooking subtle sensory or neglect phenomena neglects a critical aspect of neurologic function, thereby failing to capture the full picture of the patient's impairment. This can result in inadequate rehabilitation strategies and a failure to address all functional limitations. A third incorrect approach that uses vague or nonspecific terminology and documentation hinders effective interdisciplinary communication and can lead to misunderstandings regarding the patient's condition, potentially impacting treatment efficacy and patient outcomes. Such approaches may also fall short of regulatory requirements for clear and accurate medical records. Professionals should employ a decision-making framework that begins with a clear understanding of the patient's presenting complaint, followed by a systematic, evidence-based assessment. This involves utilizing appropriate diagnostic tools and techniques, interpreting findings within the context of known neuroanatomy and lesion effects, and documenting results in a manner that is both precise and clinically meaningful. Regular review of current guidelines and best practices is essential to maintain competence and ensure adherence to regulatory and ethical standards. Question 15. Investigation of a patient with a known diagnosis of Parkinson's disease who expresses a clear desire to stop their dopaminergic medication, stating they feel the side effects are worse than the benefits, but exhibits some subtle cognitive impairment during conversation. The neurologist suspects the patient may not fully appreciate the long-term consequences of discontinuing medication. Option A. Immediately discontinue the medication as requested by the patient, prioritizing their expressed wish above all else. Option B. Conduct a formal assessment of the patient's decision-making capacity regarding their medication, involving a review of their understanding of the condition, treatment options, risks, benefits, and alternatives, and document the findings thoroughly. Option C. Inform the patient that their request cannot be honored due to the suspected cognitive impairment and the potential for harm, and proceed with their current medication regimen. Option D. Proceed with discontinuing the medication after a brief discussion, assuming the patient's stated desire indicates sufficient capacity. The correct answer is B. Conduct a formal assessment of the patient's decision-making capacity regarding their medication, involving a review of their understanding of the condition, treatment options, risks, benefits, and alternatives, and document the findings thoroughly. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's assessment of their capacity and the potential for harm. The clinician must navigate the complex ethical terrain of patient autonomy versus beneficence, while adhering to strict professional standards and regulatory guidelines. The core of the challenge lies in determining the patient's true capacity to make decisions regarding their treatment, particularly when the proposed action, discontinuing medication, could lead to significant neurological deterioration. The correct approach involves a thorough and documented assessment of the patient's decision-making capacity. This includes evaluating their ability to understand the relevant information about their condition and proposed treatment, appreciate the consequences of their choices, reason through the options, and communicate their decision. If capacity is confirmed, the clinician must respect the patient's autonomous decision, even if they disagree with it, provided it does not violate legal or ethical boundaries. This aligns with the fundamental ethical principle of respect for autonomy and is supported by professional guidelines that mandate capacity assessment before overriding a patient's wishes. An incorrect approach would be to unilaterally discontinue the medication based solely on the clinician's belief that it is not in the patient's best interest, without a formal capacity assessment. This violates the principle of autonomy and could lead to legal repercussions if the patient is deemed to have had capacity. Another incorrect approach would be to proceed with the patient's request without adequately exploring the underlying reasons or ensuring they fully comprehend the potential risks, which fails to uphold the principle of beneficence and could be seen as a dereliction of professional duty. Finally, pressuring the patient to change their mind, rather than engaging in a supportive and informative dialogue, undermines their autonomy and can erode the therapeutic relationship. Professionals should employ a structured decision-making process that prioritizes patient rights and well-being. This involves 1. Gathering all relevant clinical information, 2. Conducting a comprehensive capacity assessment, 3. Engaging in open and honest communication with the patient, exploring their values and understanding, 4. Consulting with colleagues or ethics committees when uncertainty exists, and 5. Documenting all assessments, discussions, and decisions meticulously. Question 16. Market research demonstrates a growing public interest in understanding the neurological underpinnings of memory. A patient presents with concerns about recent memory lapses, stating they are forgetting things more often. As a neurologic certified specialist, NCS, what is the most appropriate initial approach to assess this patient's memory concerns, considering the hippocampus's critical role in memory consolidation? Option A. Conduct a comprehensive neuropsychological evaluation focusing on episodic memory, working memory, and executive functions, alongside a detailed neurological examination and a thorough review of the patient's medical history and current medications. Option B. Recommend immediate referral to a neuroimaging specialist for an MRI of the brain to rule out structural abnormalities affecting the hippocampus. Option C. Provide immediate reassurance to the patient that occasional memory lapses are a normal part of aging and do not necessarily indicate a significant neurological issue. Option D. Focus solely on questioning the patient about their subjective experience of forgetting, without performing any objective cognitive testing or physical examination. The correct answer is A. Conduct a comprehensive neuropsychological evaluation focusing on episodic memory, working memory, and executive functions, alongside a detailed neurological examination and a thorough review of the patient's medical history and current medications. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of the hippocampus's role in memory formation and retrieval, coupled with the ethical imperative to provide accurate and unbiased information to patients. The NCS specialist must navigate the complexities of neurological function and translate this into accessible, actionable advice for a patient experiencing memory concerns, while adhering to professional standards of practice. The correct approach involves a comprehensive assessment of the patient's memory function, considering the hippocampus's critical role in consolidating new memories and retrieving existing ones. This approach prioritizes gathering objective data through validated cognitive assessments and a thorough neurological examination. It also emphasizes a patient-centered approach, actively listening to the patient's subjective experience of memory loss and correlating it with objective findings. This aligns with the ethical obligation to provide evidence-based care and to avoid making premature diagnoses or offering unsubstantiated reassurance. The regulatory framework for NCS specialists mandates a commitment to ongoing learning and the application of current scientific knowledge to patient care, which this approach upholds by seeking to understand the underlying neurological mechanisms of the patient's symptoms. An incorrect approach would be to solely rely on the patient's subjective report of memory loss without objective assessment. This fails to acknowledge the hippocampus's complex functions and the potential for other neurological or psychological factors to influence perceived memory deficits. Ethically, it risks misdiagnosis and inappropriate management. Another incorrect approach would be to immediately attribute memory difficulties solely to hippocampal dysfunction without considering other contributing factors or differential diagnoses. This demonstrates a lack of thoroughness and could lead to overlooking other treatable conditions. Furthermore, offering definitive reassurance or a diagnosis based on limited information would violate professional standards and potentially mislead the patient. Professionals should approach such situations by first establishing a clear understanding of the patient's presenting complaint and its impact on their daily life. This should be followed by a systematic and comprehensive neurological and cognitive assessment, specifically evaluating memory domains known to be influenced by hippocampal integrity. Integrating subjective patient reports with objective findings, considering differential diagnoses, and communicating findings transparently and empathetically are crucial steps in developing an appropriate management plan. Question 17. System analysis indicates a patient presence with progressive weakness in the lower extremities and subjective numbness in the feet. The Neurologic Certified Specialist, NCS, is tasked with determining the most appropriate initial diagnostic strategy to evaluate potential motor and sensory pathway involvement. Which of the following approaches best aligns with current best practices and regulatory expectations for NCS professionals in this scenario? Option A. Rely solely on the patient's reported symptoms of weakness and numbness to initiate a broad panel of laboratory tests for systemic diseases. Option B. Immediately order a comprehensive magnetic resonance imaging, MRI, scan of the entire spine and brain to rule out structural lesions. Option C. Perform extensive nerve conduction studies and electromyography on all four extremities to capture any potential abnormality, regardless of the specific distribution of symptoms. Option D. Conduct a detailed neurological examination, focusing on motor and sensory deficits, followed by targeted nerve conduction studies and electromyography based on clinical findings, with neuroimaging considered if electrodiagnostic results are inconclusive or suggest a central lesion. The correct answer is B. Immediately order a comprehensive magnetic resonance imaging (MRI) scan of the entire spine and brain to rule out structural lesions. Explanation: scenario analysis. This scenario presents a common challenge for a neurologic certified specialist (NCS) involving a patient with suspected motor and sensory pathway dysfunction. The professional challenge lies in accurately localizing the lesion and determining the most appropriate diagnostic and management strategy, balancing diagnostic yield with patient safety and resource utilization. The NCS must integrate clinical findings with knowledge of neuroanatomy and neurophysiology, adhering to established best practices and regulatory guidelines for neurological assessment and diagnostic testing. Correct approach analysis. The correct approach involves a comprehensive neurological examination focusing on detailed motor and sensory pathway assessments, followed by judicious selection of electrodiagnostic studies, e.g., nerve conduction studies and electromyography, and potentially neuroimaging, guided by the clinical findings. This approach is justified by the NCS's scope of practice, which emphasizes the application of advanced knowledge and skills in the assessment and management of neurological disorders. Regulatory frameworks for NCS certification typically mandate evidence-based practice, adherence to ethical principles, and the use of diagnostic tools that are appropriate for the suspected condition. This systematic, clinically driven approach ensures that diagnostic resources are used efficiently and effectively, leading to accurate diagnosis and appropriate patient care, aligning with the principles of patient-centered care and professional accountability. Incorrect approaches analysis. Initiating neuroimaging studies without a thorough clinical examination and targeted electrodiagnostic assessment is an incorrect approach. This bypasses the fundamental principles of neurological diagnosis, potentially leading to unnecessary costs, radiation exposure, and the identification of incidental findings that may not be clinically relevant. It fails to leverage the NCS's specialized skills in evaluating the functional integrity of motor and sensory pathways through electrophysiology, which can often provide more specific information about nerve and muscle function than imaging alone. Relying solely on patient self-report of symptoms without objective clinical or electrophysiological evaluation is also an incorrect approach. While patient history is crucial, subjective complaints alone are insufficient for accurate localization and diagnosis of motor and sensory pathway disorders. This approach neglects the objective assessment required to confirm and characterize neurological deficits, potentially leading to misdiagnosis and delayed or inappropriate treatment. It fails to uphold the professional standard of care that necessitates objective verification of clinical findings. Performing extensive and nonspecific electrodiagnostic testing without a clear hypothesis derived from the clinical examination is another incorrect approach. This can lead to an inefficient use of resources and may generate a large volume of data that is difficult to interpret in the context of the patient's presentation. It deviates from the principle of targeted diagnostic investigation, which is essential for efficient and cost-effective healthcare delivery, and aligns with the ethical obligation to avoid unnecessary procedures. Professional reasoning. Professionals facing similar situations should adopt a systematic, evidence-based approach. This involves 1. Thoroughly gathering patient history, including the nature, onset, duration, and exacerbating/alleviating factors of symptoms. 2. Conducting a comprehensive neurological examination, meticulously assessing motor strength, sensation, light touch, pinprick, vibration, proprioception, reflexes, and coordination, specifically targeting the suspected affected pathways. 3. Formulating a differential diagnosis and a localization hypothesis based on the clinical findings. 4. Selecting appropriate diagnostic investigations, prioritizing electrodiagnostic studies, NCS/M, when motor and sensory pathway dysfunction is suspected, and considering neuroimaging or other tests as indicated by the clinical picture and electrodiagnostic results. 5. Continuously reassessing the patient and diagnostic findings to refine the diagnosis and management plan. This structured decision-making process ensures that patient care is both clinically sound and ethically responsible, adhering to professional standards and regulatory requirements. Question 18. The review process indicates a patient presenting with new-onset visual field deficits. The NCS is tasked with evaluating the occipital lobe structural integrity based on recent MRI scans. Which approach best reflects the required diagnostic rigor and professional responsibility? Option A. Focus solely on identifying the most common occipital lobe pathology without considering the patient's specific symptom presentation or the full range of potential diagnoses. Option B. Rely exclusively on the preliminary report from the referring radiologist, assuming their interpretation is definitive and requires no further independent assessment by the NCS. Option C. Prioritize the patient's subjective description of visual disturbances above all else, without a thorough, objective evaluation of the occipital lobe's imaging characteristics. Option D. Conduct a detailed, multi-sequence analysis of the occipital lobe MRI, meticulously documenting any abnormalities in signal intensity, morphology, or location, and correlate these findings with the patient's reported visual field deficits to formulate a differential diagnosis. Correct answer is D. Conduct a detailed, multi-sequence analysis of the occipital lobe MRI, meticulously documenting any abnormalities in signal intensity, morphology, or location, and correlate these findings with the patient's reported visual field deficits to formulate a differential diagnosis. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a neurologic certified specialist, NCS, to interpret complex imaging findings related to the occipital lobe and correlate them with a patient's reported symptoms. The challenge lies in accurately diagnosing the underlying cause of visual disturbances, which can stem from a variety of neurological conditions affecting this critical brain region. Misinterpretation can lead to delayed or incorrect treatment, significantly impacting patient outcomes. The NCS must exercise sound clinical judgment, integrating imaging data with patient history and neurological examination findings, while adhering to established diagnostic protocols and ethical standards. Correct approach analysis. The correct approach involves a comprehensive review of the occipital lobe MRI, specifically looking for evidence of ischemic changes, hemorrhage, mass lesions, or inflammatory processes that could explain the patient's visual field deficits. This would include detailed analysis of signal intensities, lesion morphology, and location within the occipital cortex and its associated white matter tracts. Correlation with the patient's reported symptoms, such as hemianopsia or visual hallucinations, is paramount. This systematic, evidence-based approach aligns with the NCS's role in providing expert interpretation of neurological imaging and contributing to accurate diagnosis and treatment planning, as mandated by professional practice guidelines that emphasize thoroughness and clinical correlation. Incorrect approaches analysis. An approach that solely focuses on identifying a single, obvious abnormality without considering the full spectrum of potential occipital lobe pathologies, or without correlating findings with the patient's symptoms, would be an ethical and professional failure. This narrow focus risks overlooking subtle but significant findings or misattributing symptoms to an incidental abnormality. An approach that relies solely on the radiologist's preliminary report without independent critical review of the imaging data by the NCS would be a dereliction of duty. The NCS has specialized expertise and is expected to provide an independent assessment, not merely rubber stamp another's findings, especially when patient care is at stake. An approach that prioritizes the patient's subjective complaints over objective imaging findings, without a thorough investigation of the occipital lobe structural integrity, would be professionally unsound. While patient history is crucial, it must be integrated with objective diagnostic data to arrive at a definitive diagnosis. Professional reasoning. Professionals in this field must adopt a systematic, multifaceted approach. This involves 1. Thoroughly reviewing all available diagnostic data, imaging, labs, etc. 2. Critically analyzing the data for abnormalities relevant to the patient's presentation. 3. correlating objective findings with subjective patient reports and clinical examination. 4. Considering a differential diagnosis of potential conditions affecting the occipital lobe. 5. Consulting with other specialists if necessary. 6. Documenting findings and rationale clearly and comprehensively. This process ensures patient safety and adherence to the highest standards of neurological care. Question 19. The evaluation methodology shows a patient presenting with significant bradykinesia and resting tremor. The neurologist suspects a disorder affecting the basal ganglia, specifically considering the role of the substantia nigra in dopamine production and its influence on motor pathways, including potential indirect effects on the red nucleus's role in motor coordination. Which of the following diagnostic and management strategies best reflects a regulatory compliant and ethically sound approach for this patient? Option A. Rely solely on the patient's description of their symptoms and prescribe symptomatic relief without a detailed neurological examination or consideration of underlying neuroanatomical structures like the substantia nigra or red nucleus. Option B. Immediately initiate treatment with a high dose of a dopaminergic agonist to rapidly alleviate symptoms, without further diagnostic workup, assuming a clear diagnosis of Parkinson's disease. Option C. Conduct a thorough neurological examination focusing on motor control deficits, including assessment of bradykinesia, rigidity, and tremor, and consider neuroimaging to rule out structural lesions, followed by a discussion of evidence-based treatment options tailored to the patient's specific presentation and preferences. Option D. Order extensive genetic testing for all known movement disorder genes without a clear indication from the clinical presentation or family history, and defer any symptomatic treatment until all genetic results are available. The correct answer is C. Conduct a thorough neurological examination focusing on motor control deficits, including assessment of bradykinesia, rigidity, and tremor, and consider neuroimaging to rule out structural lesions, followed by a discussion of evidence-based treatment options tailored to the patient's specific presentation and preferences. Explanation. The evaluation methodology shows a scenario where a neurologist is assessing a patient with suspected Parkinsonian symptoms, specifically focusing on motor control deficits potentially linked to the substantia nigra and red nucleus. The professional challenge lies in accurately diagnosing the underlying cause of the motor impairment and ensuring the diagnostic and treatment plan aligns with current best practices and regulatory guidelines for neurological care, while also respecting patient autonomy and informed consent. This requires a deep understanding of neuroanatomy, neurophysiology, and the appropriate application of diagnostic tools and therapeutic interventions. The correct approach involves a comprehensive neurological examination that specifically assesses features of motor control dysfunction, including bradykinesia, rigidity, tremor, and postural instability, while also considering the potential involvement of the substantia nigra and red nucleus. This is followed by judicious use of diagnostic imaging, such as MRI, to rule out structural lesions and potentially assess dopaminergic pathways if indicated and available within the scope of practice. The treatment plan should be evidence-based, tailored to the individual patient's presentation, and developed collaboratively with the patient, adhering to established clinical practice guidelines for movement disorders. This approach is ethically sound and professionally responsible, ensuring patient safety and optimal outcomes. An incorrect approach would be to solely rely on subjective patient reports without a thorough, objective neurological examination. This fails to meet the professional standard of care by neglecting objective assessment of motor control deficits, which are critical for diagnosing conditions affecting the substantia nigra and red nucleus. Another incorrect approach would be to immediately prescribe potent dopaminergic medications without a confirmed diagnosis or consideration of alternative etiologies, potentially leading to adverse effects and masking underlying issues. Furthermore, failing to discuss differential diagnoses and treatment options with the patient, thereby undermining informed consent, is a significant ethical and professional failing. Professional decision-making in such situations requires a systematic process. First, gathering comprehensive subjective and objective data. Second, formulating differential diagnoses based on this data and neuroanatomical knowledge of motor control pathways. Third, selecting appropriate diagnostic investigations to confirm or refute these diagnoses. And finally, developing a collaborative, evidence-based treatment plan that prioritizes patient well-being and adherence to ethical and regulatory standards. Question 20. Assessment of a patient with a recent stroke affecting their left cerebral hemisphere reveals significant aphasia and hemiparesis. The patient, through gestures and limited verbalizations, expresses a strong desire to return home immediately, despite recommendations for inpatient rehabilitation to maximize functional recovery. The NCS is aware that prolonged inpatient therapy is crucial for regaining speech and motor function in such cases. What is the most ethically and professionally appropriate course of action for the NCS? Option A. Insist on the patient remaining in inpatient rehabilitation, explaining that their current cognitive and physical impairments necessitate this course of action for optimal recovery, overriding their expressed desire to go home. Option B. Proceed with discharge planning for home, assuming the patient's desire to go home supersedes all clinical recommendations, without formally assessing their capacity to make such a decision. Option C. Inform the patient's family that the patient is not capable of making safe decisions, and that the NCS will dictate the treatment plan, including the necessity of inpatient rehabilitation. Option D. Facilitate a comprehensive capacity assessment to determine the patient's ability to understand their condition and make informed decisions. Then engage in shared decision-making with the patient and their surrogate, respecting their informed choices. The correct answer is D. Facilitate a comprehensive capacity assessment to determine the patient's ability to understand their condition and make informed decisions. Then engage in shared decision-making with the patient and their surrogate, respecting their informed choices. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interests of their neurological recovery, particularly when the patient's capacity to make informed decisions is in question. The Neurologic Certified Specialist, NCS, must navigate complex ethical considerations, including patient autonomy, beneficence, and the duty to uphold professional standards, all within the specific regulatory framework governing their practice. The core of the challenge lies in balancing the patient's right to self-determination with the NCS's responsibility to provide evidence-based care that promotes optimal neurological outcomes. The correct approach involves a thorough and documented assessment of the patient's capacity to understand their condition, the proposed treatment options for their cerebral hemisphere condition, and the consequences of their decisions. This assessment should be conducted by qualified professionals and should inform the subsequent discussion with the patient and their surrogate decision maker. If applicable, the NCS must then advocate for a treatment plan that respects the patient's informed choices, provided they have the capacity to make them, or aligns with the patient's previously expressed wishes or the surrogate's understanding of those wishes. This aligns with ethical principles of autonomy and beneficence, as well as regulatory requirements for informed consent and patient-centered care. An incorrect approach would be to unilaterally override the patient's stated preference based solely on the NCS's professional opinion of what constitutes better care, without a formal capacity assessment or engaging in a collaborative decision-making process. This disregards the principle of patient autonomy and could lead to a violation of patient rights and professional misconduct. Another incorrect approach would be to proceed with a treatment plan that is not clearly understood or agreed upon by the patient or their surrogate, thereby failing to meet the requirements for informed consent and potentially causing harm. Finally, failing to document the capacity assessment, the discussions held, and the rationale for the chosen course of action would be a significant regulatory and ethical failure, hindering accountability and potentially exposing the NCS and the healthcare institution to legal repercussions. A professional decision-making process in such situation should involve a systematic approach. First, assess the patient's capacity. Second, gather all relevant clinical information about the cerebral hemisphere condition and treatment options. Third, engage in open and honest communication with the patient and their surrogate. Fourth, document all assessments, discussions, and decisions meticulously. And fifth, consult with colleagues, ethics committee, or legal counsel when faced with complex or ambiguous situations.